All right, I just want to thank everybody for joining us and welcome. This is our sixth webinar in our series with Minnesota Pets. So be sure to check our events page on our website and sign up for our final three. And it looks like Dr. McComas is hopping on. So I will just go ahead and get started. All right, Dr. Rebecca McComas is the owner of Minnesota Pets, one of our local Twin Cities home euthanasia practices. She's joining us today to share some of what she's learned over the last 10 years about providing excellent end-of-life care, and will be giving us some tips on how to hopefully come to enjoy helping clients when a pet reaches the end of life. Kristi Lehman is the Vice President of Minnesota Pets and is a licensed social worker. She's been doing veterinary social work for 8 years and has been with Minnesota Pets for 7 years. She's excited to be here to share her knowledge about supporting clients through the euthanasia experience and how to take care of your own well-being through the process as well. So thank you for joining us.
Yes, thank you, Sarah.
Thank you. Can everybody hear me okay? I know that the audio in here might be a little bit weird.
Yes, no, we can hear you.
Okay, super.
And Rebecca, can you see my screen okay?
Yes, I can see
Okay.
your screen perfectly.
Perfect. Well, as Sarah said, thank you all for being here. I was a little worried that we wouldn't have as many signups because the title just kind of sounds a little dry, but I promise it will be interesting, and I'm really, really glad to see so many names here. Hopefully this is just a really helpful topic and kind of helps you, manage your team and keep track of everything going on in your busy practice. For those of you who were at our talk last month, Elizabeth and I talked about some overlapping topics, and we referred in that talk to several of the tools that we'll be talking more about today. So hopefully for anyone that was at both talks, you'll get the full picture. And let's see here. Sorry, I have to rearrange where my cameras are so it doesn't block the words. This is always the challenge. Okay, Rebecca, do you want to introduce Minnesota Pets?
Sure, absolutely. So by the way, I'm Rebecca, and I apologize for this weird location that I'm doing a talk from today. I am down in Atlanta, and our flight was delayed a few minutes, more like close to an hour, because there's bad weather down here. And so I'm in my little tiny rental car. But I am so passionate about this topic that I just couldn't imagine even not being here. So let's get that weirdness out of the way. And then you can let me know if my sound cuts out or if anything weird happens. Okay. So Minnesota, you probably already know, a home practice here in the cities. And we have been around for a little over 10 years. We celebrated our 10-year anniversary last year. And we really just focus on end-of-life care. So our veterinarians, we have a team of about 15 or 16 now. Most of them are part-time. And we travel to the entire metro area to help pets on the very last day, that hard day. And we also serve Duluth as well. If you happen to have clients who have a pet that passes away on its own at home, we can also come and help with that. We can bring their pet for cremation so they don't have to have the uncomfortable experience of putting their deceased pet into the vehicle. So that's what we're all about. Do you want to talk about DVM Center?
Yeah, so DVM Center is a part of Minnesota Pets. We're sort of like sister companies. Many of us overlap into both companies, but it's like a division of Minnesota Pets. We are a support team, and we answer phones and handle all scheduling, logistics, and client support for Minnesota Pets and also for other similar in-home euthanasia practices around the country and in Canada. So we manage all of their emails and all of their phone calls with clients, all of their sort of back office administrative type tasks. We have a team of support specialists who are made up of a bunch of interdisciplinary backgrounds. We have CVTs, vet assistants, some human service professionals, some social workers and social workers in training. And last year we scheduled about 19,000 euthanasia visits, and we took almost 100,000 phone calls, which boggles my mind and doesn't feel real when I say it out loud, but we have about 20 people on our team right now, which is about double what it used to be this time last year, but we've been very, very busy since the beginning of COVID. In-home services have just grown quite a bit, and clinics, as you all know, I'm sure, have been a little bit more limited in what they can do within their clinic setting, so we've just been getting some more calls for clients, so we've grown a lot in the last year. All right, my screen is a little stuck here. Let's see. Here we go.
Okay, there we go. So today, we're not really talking about pets or end of life at all. We are talking about teams and management of teams, which in a way, it doesn't surprise me that we have so many people, Kristi, who are thinking about coming to this presentation, because for those of you who manage teams, even if you're just a part of a team, sometimes that can be the most challenging part of your job. The pets and pet owners are also challenging in their given moments, but sometimes it is helping your team be fully functioning and smoothly functioning that can be the most difficult. So when you're thinking about management, these are some of the most common bottlenecks that we certainly encountered in our practice. You very likely encounter them as well. And let's just walk through them for a moment. Lack of focus. Sometimes it seems like everybody is all going in different directions and maybe aren't even sort of like, if I could use an analogy of being in a boat, we're not all rowing in the same direction. That can be a hard challenge for teams. There's lack of accountability, meaning that maybe you thought so-and-so was going to finish that up or do that thing, but then they didn't do it. That can be really frustrating. Sometimes teams lack organizational structure. You may not even exactly know who on your team is assigned to do what. Those can be blurry. Those boundaries can be very blurry. If you are a manager and you've been delegating things to people, you might have found some challenges so far with following up, and that the things that you delegate are being accomplished, are being finished. Wasted time and productivity. I think this is one of the things that frustrates us the most on a team. We all want to do our work efficiently. We want to go home on time at night. It's important to have not wasted time and productivity. I would also say that on our team at different points in time, we have not all had the same understanding of shared goals. What those strategic goals were and where we were headed wasn't always clear, and not everyone on the team understood or knew where we were headed. Maybe there's difficulty communicating between team members. Sometimes it's just via email. Sometimes you're passing quickly in the hall. That can be a challenge. And drop balls are the worst. That can really impact the quality of care that your clients receive. So these are some of the most common bottlenecks. We're going to circle back to this a couple of times throughout today's presentation, but that's where it all begins.
Yeah, and I think all of these things on this list are so closely intertwined with just how we all feel at work and how we feel in our teams and just the stress management, which we all know, especially from the last year, is just so intense for veterinary teams. And so a lot of it, comes from these things that we do have some control over, which is good news. And so some of the unique challenges of veterinary teams, a lot of the clinics that you work at and teams that you're on are smaller teams. You might wear a lot of hats. There are less clarity around roles. We just talked with some colleagues yesterday at DVM Center who were introducing themselves, and they had trouble even telling us who did what because they all kind of did a little bit of everything. And we've definitely gone through that at DVM Center and Minnesota Pets as well. But there are a lot of different roles that overlap, a lot of different hats that are shared. And sometimes there are less opportunities for delegation. It's just, I'd love to delegate this to someone, but who on the team even has room on their plate? Sometimes that can be a challenge on small teams. It can also be just a non-traditional structure. So in veterinary practices, you might have, a veterinarian who reports to a non-veterinarian, or a tech who reports to, an admin person. So there are just some different reporting structures and organizational chart differences that people might not be used to, or that just don't exist in other industries. So when you're doing research online or looking for support, sometimes that's just not quite understood outside of our field. There are sometimes part-time folks, on-call folks, just different schedules that can be difficult to work around. There's also an increased level of turnover in veterinary teams. When the team is small and roles are blurred, there's a lot to do. A lot of the work that we do is emotional, which is also, a difficult thing to manage over time on teams. It can make it difficult to gain traction with your team and to retain your team members and reduce turnover. One study showed that veterinary staff turnover can be about between 22% and 31%, and the national average outside of our industry is more closely to 12 to 15%. So it's a pretty big difference, and I think it just speaks to some of the challenges that I'm sure a lot of us have faced in our work with our teams. And I think we probably all know that there's a really high risk of burnout on veterinary teams. There's many studies about it, but one specific study that I read recently, and this was geared specifically toward veterinary technicians, which previously there wasn't a lot of research focused on techs, but the study found that they did experience higher rates of burnout than their human counterpoints, so like nurses or admin staff in human hospital settings or healthcare settings. And there are some talks coming up. I know Athena from the U of M is doing one in a couple of weeks on mental health and burnout. And then we've got a couple coming up too. So as we all know, that is definitely a challenge that we face in this field. But I think it also makes managing teams especially difficult because we are facing these challenges that sometimes other industries aren't faced with at the same level. So we are going to dive into 3 tools. And last month we talked a little bit more about like the interpersonal relationship aspect of management and the self-care aspect of management. That talk was called How to Be a Great Boss. So if you haven't, I think it should still be available, so you can go back and watch it. It really fits closely with this one. So you'll see a lot of the tools overlapping. But the 3 tools that we're really going to dig into today are called Scorecards and Rocks and Level 10 meetings. And we'll explain more about this here.
Yes. So these tools all come from this book. And I realize we've talked about this at a couple of conferences already. And I always hate putting this screen up here because this book looks really like industrial and kind of, I don't know, ugly. Like, how could there be anything good hidden in this book? But this is a phenomenal book because it describes a system. And the system is called EOS. And we'll look at in detail what EOS stands for, what it means. It's the Entrepreneurial Operating System. But what it does is what's encapsulated in this paragraph. So it is a set of tools for successful businesses. And what does successful businesses look like when they are operating smoothly? Successful businesses operate with a crystal clear vision that everyone on the team shares. There are the right people sitting in the right seats. That means people who are very skillful at their job, doing the job that they're skillful at. These companies have a pulse on their operations because they watch and manage a handful of numbers. And that is one of the 3 things that we're going to be looking at today. They identify and solve issues very promptly in an open and honest environment. Documentation of process is really important. So in your company, in your practice, you've got a couple of core things that you do day in and day out. And those are things that you will want to document. That ensures that everybody is doing it the same way, which also ensures that your clients receive excellent care and service, no matter what day they come in or who they might see.
Perfect. So, and Rebecca, you are freezing just a little bit. Can you hear me?
The priority for operating smoothly have high levels of communication.
Okay, it sounds like we might be losing Rebecca. Rebecca, can you hear me?
I have a little bit spotty internet connection,
Okay.
It looks like here, but I can hear you. If I cut out, just on wherever I was, okay?
Sure. Well, and a lot of what Rebecca is mentioning from the screen, these are the exact kind of philosophies and values that we will be digging into on all of the following slides. So even if you didn't catch what she was saying, we will go through all of these things much more in depth throughout the talk here. And with with the EOS model, with the traction model, sorry, Rebecca, I think you're back. I don't mean to interrupt you. Oh, maybe not quite. Okay, so with the traction model, it's the EOS model, the Entrepreneurial Operating System. We adopted this, I want to say about 6 years ago at Minnesota Pets and DVM Center. We adopted this for a couple of reasons. We were just growing really quickly, almost too quickly to keep up with, and we were adding a lot of people to the team, people who had really great ideas that we wanted to, bring onto our leadership team and really infuse our company with some of this growth. And we were just kind of feeling like we were having trouble getting traction with all of our new goals and our new people. So we implemented this traction model. And I think, if I remember right, VHA also has implemented this model, and I want to say AERC has as well. And some of you in the audience you might already be using this at your clinic too. And Rebecca, I think you're back. Can you hear me okay?
So.
Okay.
Yes, I can
I'm
hear
sorry.
you perfectly right now.
Okay, perfect. Well, I can hear you too, so I'll let you finish going through your slides.
Okay, sounds good. So this is just a first kind of quick glimpse at what the 6 different components of the EOS model are. It all starts with vision. Vision is what you do and how you do it. The people and data components come next. Data is what we're going to spend quite a bit of time today talking about. Issues and process are next. And issues are a part of your meetings. And we are going to go into a lot of detail about how EOS recommends that you hold your company meetings to make them the most productive, the most efficient, and certainly the most enjoyable possible. And then the result of all that is that your practice starts gaining traction on things that you want to implement in your practice. If you want to grow, for example, if you, whatever your goals are for this year, putting all of those things together in traction is what makes that happen. This is an article that was published a couple of years ago about the use of EOS tools in Minnesota specifically. And I love this because I'm super proud of our state of Minnesota, but I think we are smarter and hardworking than a lot of other places. And so that's why EOS has really caught on in Minnesota. Thousands of companies in Minnesota are using it, but really tens of thousands of companies have adopted this system all across the United States and Canada. If you look online, there is a sort of a huge community of people who are sharing resources about how to do this. And one of my favorite quotes in here is that the people who try it and like it really, really like it, and they become evangelists. And I've used the word evangelist for myself in the past about EOS because I am an evangelist. I don't know if you'd put yourself in that category too, Kristi, but you will become very devoted to it once you start using it and if it works for your team.
Yes, and I see Delaney from AERC, it looks like, and then Sarah confirmed VHA, both use the EOS model. I would be super interested in hearing if anyone else here's clinic, if your clinic uses it or your company. If you want to put that in the chat, I would be very interested to see if other people are using it. And I would say, from someone who didn't come from a business background originally, when I first came into work and I found this book on my desk and Rebecca was telling me, I think we should start implementing this. It did at first, it didn't feel quite right. I had worked at other large corporations, like a Starbucks Target type place. And that sort of jargon or these words, it sort of was I was worried that it would be like a turnoff for our staff. And so I had to be convinced a little bit at first. And some of you might be reading this and thinking that it sounds kind of cult-like, which I think it can sometimes, like you mentioned, Rebecca, with the evangelist, but it really has been transformative. And I feel like what has been helpful for me with my social work background and lens is that it gives us a good model to get things done that need to get done, and it frees up so much more energy and space in your day and in your company for things that really, really matter, like the client experience and your relationship with your team, your relationship with the people that manage you or that you manage. And so I felt like it made a really good space to get the things done that had to get done, be efficient about it, keep everything on track, make sure the company is taken care of and therefore the employees are and their financial well-being. And then it just frees up everything else so that you don't have to just drown in all of those details every day.
I'm so glad you brought that up, Kristi. This morning, as I was thinking about us talking about this today, I really wanted to hear, because I was all on fire about this when I brought it to you guys. And our team was small at that time. There was just a few of us that were all sort of making this decision based on Rebecca's intuition that this was a good idea to do. What did it feel like to adopt a new set of skills that were mostly unfamiliar and, like you said, full of jargon?
Mm-hmm.
How do you, like, based on what it was like for you, what do you advise as somebody who's kind of sitting in on this presentation today and they're feeling convinced after we're all done talking about it? How do you suggest that they would present it to their team to
Yeah.
maybe improve the chances of success of adopting it?
Yeah, that's a really good question. I think the first thing I would probably say, the thing that helped me was just reading through the book and keeping an open mind and just, knowing that other companies have used this in a way that I wouldn't say that it's like run our lives. It's really not something that, it's not in our face every day. It's not all we think about. It's really kind of just the backbone. It's just provided a structure for our meetings and things like that, which we'll talk about during this talk. But it's sort of like the foundation that we can build the house on. And we don't really think about it. It's just there and everything else has built on it. And so it isn't a total change in terms of completely wiping your slate clean and starting over. It's more just implementing some sort of structure so that, like I mentioned earlier, so that you're not tripping over a lot of details, and it kind of helps you solve some problems. And I would say it's one of those things. I know sometimes when the management team has a new idea and brings it to the rest of the team, sometimes, the initial reaction is like hesitancy or just not feeling quite sure about it. But I think starting small and maybe implementing some aspects of it can be helpful. That's one of the things I like about this talk. We'll talk about 3 things that even if you don't want to read the book completely or implement the entire system, these are things that you can use, with or without the entire traction model. And so even if you kind of dip your toes in and see how that goes, see how that feels for your team, it might be easier to kind of grow from there too. And I
Totally
think
agree.
I'm having, the chat keeps disappearing on me, but it looks like a couple other people locally are able to, they're using traction too. So that is really cool.
Awesome. That is.
So there are these 6 components, as Rebecca mentioned. We won't spend time talking about all of them. In fact, that would be probably an entire conference in and of itself to do that. And it is a conference
Yes.
somewhere. So there's a lot more information in the book and online. And I really don't want this talk to be us just sort of regurgitating the book, because it's out there and you can use it however
Mhm.
feels comfortable for you. I mostly want to share it in a way, just kind of through our lens of what has worked well for us, what has worked well for our team, what has been most transformational, so that we can kind of distill that for you busy clinics who may not have time to totally
Mhm.
overhaul your your structure right now. So these are the 6 components. When it says issues, I just want to point out that means problems to solve, pain points. One of the most transformational things about this model for that I've noticed for my role and for our company is that it's totally changed how I think about issues. They used to be things that kind of crept up that just get a sick feeling in your stomach about, they won't go away. And now I kind of like them. Like if someone brings up on our team that there's a pain point or something's not going well, I really almost celebrate it, which feels strange to say, and you might not believe me, but I do feel like now when there's a problem, it's like, awesome, we know about this now, let's solve it. And really, we've learned that there is no problem that we can't solve, which I wouldn't have necessarily believed before we celebrated them in that way. So that is one way that it sort of changed my lens about issues as well.
I guess I would agree with you too and say that we're not afraid when problems
Right.
come up anymore. Like, oh my gosh, we're never going to be able to tackle that. It's just a daily part of life to know that we're going to be discussing whatever issues have come up in the last week or the last month. So it's less frightening, like
Yeah.
a lot more confidence that we can do it.
Yes, and we've tried to really instill in our work culture that that is celebrated and that no one should feel afraid of bringing up a problem. It's not seen as complaining. It's something that we welcome and encourage. In fact, in the past, we've even done some contests to see who could bring up some pain points that could be solved. So it has definitely been really helpful for us to think of issues in that way. So these are all of the tools that are listed in Traction. As you can see, there are a lot. Some of them are really just things that we might sit down and use once a year or a couple of times a year. But the things that are used most often and that we found most helpful are, let's see here, are these three. So today we'll talk about scorecards, rocks, and then level 10 meetings. I think if you don't implement anything else with Traction, these are three things that at least could give you a different perspective or a philosophy that you could use at your practice. And some of you might be doing some of these things already and just not be using these words or thinking about it in this way. So even though we might be using different words, I think we're speaking the same language as probably some of you already are doing at your clinic.
And before we jump into this first tool, I will mention that it took us several years to implement the use of all of those. That is not something that I think any practice can like, okay, by year's end, we're going to have that whole list finished. It took us a while, and we're do-it-yourselfers at Minnesota Pets. And so I know that some of the companies in Minnesota that are using it work with a person called a certified implementer. And that's somebody who knows everything there is to know pretty much about EOS tools. And you meet with them like quarterly, and they help you make more rapid progress through implementation. If you're do-it-yourself like us, you don't need to have an implementer by any stretch. And Kristi and I's perspective today is just people who have been in the trenches using it daily for many years. So we are not coming from the perspective of a professional who trains other teams on how to use it, but we certainly have day-to-day experience with each of the tools that we're going to be talking about with you. For so long that I think we could probably explain this at a dinner party, like to people who have nothing to do with it and have no idea, and they would still walk away hopefully understanding what we're talking about. But let's dive in. So tool number one is called Scorecards. In Scorecards, I'm going to my glasses back on so I can see my notes. This is found in the data component. So we're going to touch on the data component for just a little while, and then the other two won't be involved with the data component. So if you want to go to the next slide, this will give us a view of kind of an example of what a scorecard could look like. And what is a scorecard? It's a handful of numbers that you and your team watch, and you record them and report on them so that everybody knows what those numbers are. EOS would say that that's taking a pulse on your practice or on your company about how things are going. I think that pulse is kind of funny because we're in a medical field, so it sort of fits. This, I would say, for many people on your team at first might be a little bit unfamiliar. And it's because some people really like to focus on qualitative measures of how you're doing. For example, they would say, like, we had so many thank you cards that came in this month for the services that we provided, or I know that we're making our clients really happy. Those are more sort of qualitative measures. A scorecard is quantitative, so it's numbers. It's reporting and recording numbers. And at first, people might be reluctant to believe that numbers tell a story. But I would say that in our practice, we have completely embraced the idea that numbers have their own story to tell. And so don't be discouraged if at first you get a little bit of resistance from people who are sort of more on that qualitative side of things, because once they start seeing results over time, they will begin to believe more in what the data is telling them and what the data is showing them. So don't be discouraged if that were to happen. So if we look at this example of a scorecard, the big column in the middle called measurables, that's just a description of what it is that you're watching. And we're going to look at a specific example in just a minute. The left is like who's in charge of it, who's responsible for that number. And each number has only one person who is responsible for reporting it. That person isn't responsible for like getting the result that needs to be gotten, because that's your whole team. Everybody working together does that. But one person reports on it. You want your team to know what the goal is. What are we shooting for? Like, if it's number of appointments per month, what's our goal? Like, how many do we want to do? And then you track it over time. Maybe you track it weekly, maybe you track it monthly. We're going to look at some examples in a minute. If you want to go ahead to the next one. So this was our list of all the bottlenecks that can happen on your team. When I thought about scorecards, I really think that it has an impact most on these three things, the things that have an arrow. When you have a scorecard, it's a laser focus, like you know exactly what you're counting. There's definitely a focus on those individual numbers that your team has decided are the most important. It also gives accountability because that column who, that person who is assigned to report on that number has ultimate accountability for the reporting part of it. Your whole team, of course, has accountability for achieving the goal, whatever goal it is that you set. And because you have a goal actually written down in black and white, it gives so much better understanding on your whole team about what your strategic goals for any period of time might be. Maybe it's a quarter, maybe it's half of the year, maybe it's a whole year, but it makes it really clear to everybody, what are we aiming for and what are we shooting for?
Mm-hmm. And I think the scorecards, I have felt like they make performance management so much easier too. It's so much easier to talk with the people that you manage about what's going well and what's not going well without this element of like, it's just so much more objective. It's so much easier to sit down with someone and look at a number and be like, you're doing a good job. This number is not quite what we want to see. So what should we do? It's not usually a problem with them. It's a problem with a process or a system that needs improvement. And so I feel like it just takes that discomfort out of those sort of conversations a little bit more. And it makes it less scary to have them, which is important.
Yes. Yes. So if you're kind of struggling right now to think about, well, what would be some numbers that we would want to look at? I bet for many of you, you're not struggling at all. I'll bet numbers come to mind right away for you. So if I create a list that I think would be applicable for most general practices, this would be some of the things that I would really want to be paying attention to. On a weekly basis, it's our overall appointment availability. How did we do? COVID has been insane when it comes to appointment availability. And we know how much practices are struggling because we hear of clients who maybe reach out to us for information as well. It can be really tough right now to get everybody in. Appointments seem to get snapped up really, really fast, and our wait times are longer than they've ever been. When you start to, when all of us, I guess, start to return to a more normal situation, watching what your appointment availability is doing on a weekly basis would be really helpful. You maybe just want to keep a count. It might be such a depressing number right now that it might be hard to keep an accounting of it, but keep an eye on how many people you're turning away because of lack of availability. That would be something to look at sort of on a weekly pulse. If you want to think about monthly numbers instead, what are your total transactions for the month? How much income came in and what were your expenses? For those of you who track your practice financials right now, that's your profit and loss statement. That's what you've been working on probably lots and lots. So you already have some scorecard items for sure. As far as quarterly, these are things that you don't need to look at quite so often. You might want to look at how many new clients you have on a quarterly basis. That would not be very helpful probably on a weekly basis. That would be too often. The same thing goes for looking at how much you're spending on marketing. I would look at that quarterly. I don't think it needs to be more often because you may do nothing at all one month and then a whole bunch the next month, something like that. Same thing with social media. It doesn't need to have such close ends. And then of course, you may not look at even more than once a year. And that would be, this is a super interesting one, and I bet many of you already look at this, is in your practice, all those revenue centers that you have, how much on a percent basis of your total revenue comes from each of those centers, whether it's surgery or grooming or boarding or whatever it may be. You want to know where your profit centers are in your company. Average transaction charge doesn't change super fast. Probably a lot of your practices are raising prices periodically. Maybe once a year you go through a price change. So looking at average transaction would be helpful. And then total active clients. I would look at that also sort of on an annual basis because you want to know if those numbers are increasing or declining. That would be good. And you can go on to the next. This is a look at just a snippet of our scorecard. And because, as Kristi said at the beginning, we do have kind of our two sister companies, Minnesota Pets and DVM Center work together, but it's sort of like two divisions. And we really love numbers, so we want a lot of numbers. Our scorecard has quite a few things on it because we get really interested in a lot of different numbers, but you can see the middle row, or I'm sorry, the middle column describes what it is that we're watching. And then this column that's over to the right in sort of gray defines who has to go find the number, who reports the number. And some of them are just calculations. It's like a percent, for example. And so it isn't always something that you have to go dig out of your software or whatever. This is an Excel spreadsheet. If you have come to enjoy using Excel or you vehemently despise Excel, it is a really good tool for looking at a scorecard because you can use all those columns going out to the right so that you can see it over time, see your numbers over time. Do you have anything, Kristi, that you want to add about the scorecard itself?
You know, one of the things that I was thinking about as I was listening to you speak, and I was just trying to hear it through the ears of other people here who might, like, this might be a totally new thought. And I guess I will also say, if anyone here is already tracking scorecards, but maybe not calling it that, I would be super interested to hear that too. I'm guessing a lot of practices watch certain metrics and data, but maybe it's not all in one spreadsheet, and maybe it's not transparent for everyone on the team. I think those are the game changers that I've noticed. But one of the things I was thinking about is how when we are doing this work of like this heart work, this, work that we put our heart and soul in, helping clients, helping patients, most of us didn't come to this work because we care about metrics and we care so much about profit margin. We're here because we care about pets and the people that they belong to. And so I think one thing that can sometimes turn teams off of this idea is the feeling that this is very reductive, that we're just thinking of our patients and our pets as numbers or as metrics. And I want to kind of dispel that myth a little bit. At least from my perspective, as a social worker, I feel like these numbers tell so many stories. And if you look on our scorecard, for example, we keep track of how many clients we have to refer out, how many that, who we can't help. We have to say, I'm sorry, we're full today, but I can give you another phone number. We track that very carefully because it is an important number financially, but more importantly, those are people, those are human beings that we're not able to meet, and to help when they need help. And so I think all of these numbers are important for many reasons. Even the more boring kind of financial behind the scenes numbers, those still matter because that plays into the financial health of the company, which impacts our employees and their own financial health. And so to me, all of these numbers are stories and they reflect human beings and pets. And so I don't want to I just don't want that myth to ever hold anyone back from caring about metrics or data. I think it can really just be really helpful in providing that service to clients and to patients.
Yep. And one last thing to add about scorecards, you don't have to share every single number with everyone on the team. You may have a scorecard that you look at only with your leadership team, or possibly only the practice owner and the business manager, maybe the only people that have a line of sight to certain numbers. So it's not like we publish every single number to everyone on our team.
Right.
Last thing on scorecards, really quick, these are some of the results that have happened for us, and I think are realistic could happen for you and your team as well. We do know our important numbers. If somebody asks us how many pets we saw last month, we know that number. I think our team makes smarter decisions when we don't just rely on our gut feeling or the emotional sense that we have about something, but we match that with what the data is telling us too. It has definitely helped as a practice owner to increase transparency with our team on the things that really matter. Our team has so much of a better understanding, I think, now than we did 5 years ago on how our business runs and what really impacts things, at least on a business level. And when your team has to make tough decisions, like, hey guys, I thought we were going to be able to hire that extra receptionist this summer, we can't. And it's because there's certain financial goals that we haven't been able to meet or whatever it might be. I think people are much more willing to accept those kind of decisions when they have seen it kind of leading up to that. They kind of can see it coming. And sometimes businesses do have to make hard decisions. It definitely improves people's understanding. Really quick example, we were doing hospice for quite a while in our practice, and it just didn't even pay for itself. It was like a drag on our business quite a bit. And so as much as it hurt to say, I know we've worked so hard on building this program, we have to let it go. Nobody on our team was surprised about that. And we really refocused on what our core mission was, which is euthanasia services in the home. So it went much better than it would have gone, I think, if people hadn't seen the data leading up to that. Well, that's all that I've got for that one.
Well, and we have Michelle asked in the chat, which numbers would we recommend sharing with the whole team? It sounds like for some teams, it can be difficult to know what scorecard numbers to be transparent with and which ones to maybe hold back. Do you have any thoughts on that, Rebecca?
Probably profit and loss is tough for people to really get a handle on what that means. And so I probably wouldn't share that information as much with like the whole team. But wow, would I focus on the numbers like you mentioned earlier, the ones that really impact pets and people. Like, how many did we have to turn away? What is our goal for staffing this year? How many people are we going to bring on board our team? How many pets per month do we have to see in order to justify bringing on one more technician? Because we'd be so excited to have that extra team member and that extra pair of hands. So look at your numbers that really impact the heart of the work. And that is what I would share with the team. And I wouldn't overdo it, especially at first. Just share a few and kind of let people start getting used to the idea of seeing that. And I bet you anything, they will start asking questions. What if we looked at this? Or what if we counted that? And that's when you decide to start adding new line items to your scorecard, because it's the things that start to matter a lot to your team.
Mm-hmm. And we've been, in terms of even how to share those numbers, we have started doing a quarterly state of the company address where we share some of our highlights, our rocks, and our scorecards. So doing something like that quarterly, face-to-face, like a town hall type of meeting is really helpful. Sometimes we'll do like weekly or monthly email updates. And sometimes we just have a really exciting number or a record or something like that we want to share as just a celebration and a good job to everyone on our team. So sometimes we don't routinely share scorecard numbers just because they may not be that interesting to all of our staff. But when something exciting is happening, then we definitely try to be transparent with those too. That's a good question. All right. And if any other questions come up about scorecards, still feel free to chat them, but we'll move on to the next tool, which is rocks. Rocks are sort of another word for goals. They're usually the 3 to 7 most important things that you really need to and want to get done in the next 90 days. So this worksheet shows you sort of how you could organize those. I'll show you an example of how we've organized them. why they are called rocks is because if you look at this, I think it was Stephen Covey, if I remember right,
Yeah.
was
Yep.
he had this idea of this jar where, you know, the rocks are your most important things that you want to get done, your tasks that really have to be completed to keep things moving along. The rocks are sort of like the fires that come up that you have to put out, and the sand you can't see, but the light color there in the jar is sand. That's sort of like the day-to-day little details that trip you up. I don't know about you guys, but sometimes I have a to-do list that I just never even get to because I'm just answering my emails. That's the sand. If you put the sand in first and spend your time only on that, and then the rocks kind of fill up, you usually don't get to them. There's just not time. They never seem to rise to the top of your to-do list. However, if you start by focusing on the rocks, if you carve out that time, if you find ways to prioritize them and do those first, the pebbles and the sand kind of fall into place and you're able to fit the lid on the jar. That's kind of the illustration or the visualization, but I hope that analogy makes sense to everyone. So the rocks are really the things that, 90 days from now, what do I want to look back and be sure are done? What are the things that are going to improve our efficiency, improve our team, improve, those sort of things? A lot of it can be based on improvement or issue solving, but the rocks are those 90-day things. We talk about 90 days because usually that's the amount of time it takes for you to get some of these big projects done. My rule of thumb that if it's something I can get done like in an hour, it's probably not a rock. It's more just a to-do on my list that I'll do. But if this is something that has multiple stages, a project that might involve other people and different steps, that to me is a rock because those tend to be the things that I will put off if I can because they're so big, I don't know where to start. So I try to prioritize those things. And 90 days is about the right amount of time to get some of those things done. And they've kind of, in the book, they talk a little bit about how 90 days is sort of that time frame where after that we lose interest or focus. And sometimes after 90 days, other more important things have come up anyway. And so that's why we kind of break it up into 90-day chunks. So the problems that are addressed by having rocks are the lack of focus, lack of accountability, especially I think that one is important because then, especially if you're a manager, you have a line of sight to everyone's rocks. I have felt like when I started managing, the most difficult thing for me was not the extra items on my to-do list. It was that now I also have all of these other people's to-do lists that I kind of want to know, like what's going on, what challenges they're having, how I can help, what's falling through the cracks. So not only do you have your to-do list, but you have, potentially a dozen other people's to-do list to think about. It helps with delegating and following up. It definitely helps with wasted time and productivity, and of course, dropped balls as well. So when we talk about rocks, we think of them as smart goals. Some of you might be familiar with that phrasing, but we try to make sure they're specific. We try to make sure they're measurable, which we have found is much more challenging than you might think to make sure that they are something that actually at the end of the 90 days, you can say, yes, it's finished or no, it's not finished. That takes some practice to write those to be measurable, that they're attainable and realistic, that they're things that really can be done in 90 days, and that they're timely, that you can kind of fit them in that chunk of time. Otherwise, they may need to be broken up and it might actually be several rocks over several quarters. So we try to make sure all of our rocks are written smartly.
I hope that acronym is familiar to most people. I think we've all heard it somewhere, but it maybe has been a while. So that's a good review.
Yes, and we shared this example in our last talk last month, but this is an agenda kind of format that we use with our team. Each person on our DVM Center team has a rock. Even if they're a brand new employee, they have a rock. Their rock is just to, get through their training or complete something that they are doing for the first time. And so every person on the team has a rock, and that rock is hopefully related to the overall, company success that quarter. And so it's relevant to the goals of the whole company. So we use this agenda when we have bi-weekly check-ins with our team, and we go through a lot of things. As you can see on the top, we kind of broke all of those things down in the last talk, but on the bottom, we revisit the goals and the rocks that they have for themselves. For our team, like our frontline staff, we tend to break down their rocks into actual monthly rocks rather than 90-day rocks, because it just is a little bit more manageable for them and the time that they have to spend on them. But we check in with them about that every other week when we have our check-ins, to make sure everything's on track. Their managers make sure that their rocks are, not stuck somewhere that they might need help with. So we make sure that that is strumming along. And I think that's really important, because rocks can easily be something that you write down at the beginning of the quarter and then don't think about again, which, like last year during COVID, when things were really, really changing quickly, it was easy for us to forget about our rocks. And a couple of times we just had to abandon them and just kind of keep putting out fires. And that happens sometimes, and that's okay. But ideally, you want to be revisiting them very often so they're fresh in your mind, you're prioritizing them, your manager knows what's going on with them, or if you're a manager, you just know where everyone is with their rock. So I have just a couple of examples here. Some of these are old, but I wanted to include some so that you can see. We have the quarter that we include the status, where we are with them, who is doing it, what it is. So for example, one of my rocks was to write our holiday grief series for Minnesota Pets. And it was one of those to-do lists or to-do items on my list that I just kept putting off because it so takes creative energy and it's a really big project and I needed help from several people. It's really easy to put those off and just kind of decide not to do them. But making them a rock, I just kind of broke it down into several pieces and kind of pushed through it as much as I could. So you can see this is what we do. We use Excel, although I will mention that, and we talked about this in our last talk too, but we started using 90. It's a software, or it's a website, I guess I should say. It's not free, but it's been very helpful for us to implement traction. It's a place for us to organize our rocks and our agendas and our scorecards. So it's 90, I think it's 90io.com. And that's a really helpful tool. So some of the things that we've noticed from using rocks, we remember what we've assigned to people, which to me is like half the battle. So we can remember what we've delegated and who is working on what part of the rock. We can help them remember what they've agreed to work on. And I don't know if any of you run into this, especially when you're working on projects on your teams, but you have a great meeting, you have some good ideas, and you leave, and they just kind of stay at that meeting and they don't come to fruition. And I think part of the challenge is that we just don't have good record keeping sometimes. I mean, we've definitely stumbled through this where a couple months later, we're like, didn't someone talk about doing this or changing that? We just didn't know because we weren't doing a really good job of documenting. So that has helped a lot. It also helps to know in advance if we're not going to finish something on time. We fail rocks all the time. We get to the end of the quarter and we actually look back and decide that, that seemed really important 90 days ago, but with everything else going on, it turns out that wasn't as important as I thought. And that's okay. Or it's something that we just didn't finish and it's going to be brought into the next quarter, which happens often too, and that's okay. We avoid the dreaded "why didn't you get that done" conversation. So again, this is a really helpful tool for performance management and team management. There's also really good clarity about what everyone else is working on. I really appreciate this about having rocks and having them all in the same place and on the same spreadsheet. Rocks are something that can be pretty transparent, probably even more so than scorecard items. And so everyone on the team can see what everyone else is working on, which is especially helpful when we've been remote or when we don't have overlap. There are some people on the team that I rarely work with because our schedules don't overlap, but I like to see what they're working on and I kind of want them to see what I'm working on too. It also helps with workload balance because you can visually look at a list of what everyone has on their plate and you can see, Maggie has 8 rocks and Elizabeth only has 2. Maybe some things can wait for Maggie's, or maybe Elizabeth could help Maggie with some of these. So it just visually shows you who on your team might have a little bit too much on their plate and who might have some room for others.
This is a lot to talk about.
Yes, it is.
How are we doing for time, Kristi?
Yeah, so we have about 5 minutes. So
Oh my gosh!
I
We only
know
have
that went
5
by
minutes
very
left.
quickly.
It did. I'm just going to briefly summarize what a level 10 meeting is. And people might wonder where the heck that name came from. It just means that at the end of the meeting, if everyone gave it a score, everyone would give it a 10 out of 10 because it's so productive, it's so efficient. So let's go on to the next slide and see. You might be thinking I'm wacky, by the way, to say that meetings can be wonderful. A 10 out of 10? I've never had a meeting that's a 10 out of 10. Meetings don't have to be awful. If they are organized in the right way, they're super productive, very efficient, and we've come to love them because that's where most of the work happens. This is going to be some homework for you. If you want to implement level 10 meetings, you'll have to go online and do a little bit more in-depth reading. But the essential element, I think, of these meetings is that you always have the same agenda. No matter which team is meeting, no matter when they're meeting, the agenda is always the same. And this is what it looks like. You spend 5 minutes talking about, okay, leave behind whatever it was that you just came from. How are you doing today? How are things going? You look at your scorecard, you look at your rocks, but very quickly, it's just a quick review. It's on track or it's off track. The majority of what you spend time on is checking off the to-do list to say, yep, those are all done. And here's the issues that we have to tackle today. The majority of your meeting time is spent in an open, honest dialogue about here's the problems that we got, here's what we need to solve. At the very end, we do rate our meetings. And if you think it's not good enough to earn a 10, if it's anything less than an 8, you have to say why, so that the next time you can do a meeting differently so it meets the objectives that you have. And really, I don't think we need to go into more detail about meetings, but let's a couple of the results that might happen for your team as well. Totally gives you focus and accountability. Delegating is so much easier because it all goes on that to-do list and you can follow up at the next meeting to make sure it's been done. Gone are the meetings that are a waste of time. These are highly productive and very much checking off a lot of problems and getting an action plan in place. Communication is so much easier. Same day, same time, same day of the week, same people involved. So you really get a flow going that everyone was here the last time when we talked about that problem. Now we're revisiting how our solutions are. What do we need to do next? Communication is so much better. And as far as dropped balls too, much, much fewer dropped balls. These are a couple of the results that we have had. Problems get solved. I think we talked about most of these anyway. We can go on to the next one. Are there any questions, Kristi, in the chat window that we haven't addressed?
Not right now, no.
Okay, this is the software, by the way. It's 90.io, which is really a weird, like, it's not a .com, it's a .io, whatever that stands for. This is a cool software. So you can check it out if you want to look at it.
And I think the thing about software, or if you use a Word document or use an Excel spreadsheet, I feel like one of the things that I would like drive home right away with your team if you do these sort of agendas is document, like during the meeting, normalize stopping and everyone's silent while they write down, you know, a to-do or a task. I feel like we have so many good conversations. It's really easy to get caught up in that and then leave the meeting, like I mentioned earlier, without knowing who agreed to do what or what the next step is. And so really normalizing, like writing down who is doing what the next step is, what the follow-up plan is, that has taken me so much practice and I'm still trying to really do that. But I would say that is a huge game changer, especially when you're using this same agenda every single time.
Yeah, absolutely. And then you're always starting from the agenda from the last time that you met. So your notes that you've taken on our to-dos, they're right there from the last time. So it's good.
Yes.
Are there any residual questions at all? I can't see the chat window from my screen, unfortunately.
I don't see any. If anyone has a question, feel free to type it in the chat here. Otherwise, here's our, we have our email addresses here. If you ever have a question, just specific or want to check in about something or how we do something at Minnesota Pets, feel free to send us an email. We're happy to help.
And I know it's coming to the end of the hour, Sarah, or we might even be past it now. If people do have questions they want us to stick around, we can stick around for a few minutes. If everybody needs to sign off and go get their lunch or do whatever that they need to do, it's no problem. But we're happy to stick around and answer something specific.
Perfect. We'll just hang out for a couple of minutes, and if you have any questions, go ahead and use the chat. And I just want to remind everybody, our next session is going to be April 29th, and that's at 12 p.m. And it's going to be When It Isn't What We Would Choose, Managing Bias During End-of-Life Care. So be sure to hop on to the VHA website under our events calendar, and you can sign up for all of our upcoming events.
Thank you for hosting, Sarah.
Thanks for speaking.
Well, you do such a good job getting these all set up.
Yes.
Thank you. We have lots of messages saying thank you and a good review for us.
Somebody needs a copy of the slideshow. I think we can put it into a PDF and get it to you, Sarah, so that you can send it out. Sure.
Perfect. And then I will be sending out certificates and information about our next sessions probably tomorrow morning. So be sure to check your inboxes for those. I'm not seeing any questions come through the chat, so
Okay.
I think we will end. Actually, hang on. I would love, someone did a Q&A. I would love a PDF of the presentation as well. So we will definitely get that to you, Michelle.
Perfect.
Other than that, all right. Thank you, Kristi. Thank you, Dr. McComas. We really appreciate you being here.
Absolutely. Thank you, Sarah.
Thank
See
you.
you next month.